Today's lecture is on professionalism and success. Professionalism in medical assisting. Competence in professionalism. We talk about hard skills and soft skills. Hard skills include technical and operational, such as scheduling appointments, coding for insurance, interviewing patients, and taking vital signs. Soft skills are also known as people skills, characteristics, attributes, your attitude. Do you have a good work ethic? And they cannot be overemphasized. Professional behaviors include comprehension, the ability to learn, retain, and process information in an ongoing process. Persistence, continue in spite of difficulty. Perseverance and tenacity. And self-confidence, believing in yourself. Judgment, evaluating and acting appropriately to situations, known as critical thinking. Knowledge, gained through study and experience. Organization, completing jobs in an orderly fashion. Integrity is about being honest and trustworthy in all situations. Growth is an ongoing effort to learn as you continue through your life as a medical assistant and going on if you continue to learn more. Teamwork, working with others in the best interest of completing the job and being able to work with others. Team dynamics vary, so we need to be flexible and to kind of step back and look at how the team is functioning and seeing what we can do to make things work. We need to be able to accept criticism. We have constructive criticism. Now, constructive criticism or counseling or advice intended to be useful from a coworker or a superior. This is not personal judgment. All right? People who need constructive criticism and people who think they can handle constructive criticism meet in the middle of this diagram. People who can actually handle constructive criticism. So remember, if your boss is telling you or giving you information on how to maybe work with a patient in a different way or chart in a different way, this is not an attack on your personal life. This is constructive work criticism. Relationships with others. We need to be able to show empathy and to have professional boundaries, to treat patients as clients and not personal friends. Remember, they're entrusting you with their life. And the difference between empathy and sympathy is this. Sympathy is taking on and feeling what they're going through and being reactive to it. But empathy is understanding what they're feeling and being able to step back and be professional and allow them to voice how they're feeling. What about cultural diversity? We need to be able to respect and understand everyone, no matter what religion they're from, no matter what ethnic or race they are in, no matter what their life circumstances are. We need to be able to respect and take care of everyone. Patient advocacy, speaking or acting on behalf of the patient or family. What about your work quality? Are you striving for excellence in job performance? That's about being able to take constructive criticism well and to work on continuing education improvements. So work quality is striving for excellence in job performance. Punctuality and attendance cannot be stressed enough. Being on time and present for a scheduled shift. In healthcare, you need to be 10 minutes early. So if your shift in your externship is from 8 to 4, you need to be there at 10 to 8. Class starts at 8:25 or 8:30 here at the school. You need to be here 10 minutes early. That's punctuality and attendance, and always attending class. Professional appearance. We talk about conservation. Conservative style is best. So solid colors, quiet colors, nothing flashy, no big makeup, no crazy hair, no big earrings, and not a lot of jewelry. Communication. Do you know how to listen, to observe? Do you speak well? Do you write well? And do you have good manners? So communication is about listening, observing, speaking, writing, and using good manners and being respectful. Here are some strategies for success. In this diagram, you'll see at the bottom, we're going to go through this in just a moment. It's about critical thinking and problem solving. We need to analyze situations, determine the most important areas that need work, and reach conclusions which go beyond the obvious. So let's look at number 1. Identify the problem. What is wrong with the patient or what is wrong with the scenario? Number 2, identify the effects of the problem. What effect might the patient's behavior have? Number 3, identify the objectives or outcomes. What is your goal for this situation? And how about solutions? Come up with a few solutions on how to handle the problem. Now analyze the potential solution that you came up with. What would be the best result? And then put it in place and then evaluate how it happened. All right? That's called critical thinking and problem solving. Time management and prioritizing. High achievers control how time is spent, and effective medical assistants learn to prioritize their duties. Stress and burnout can result without use of time management and prioritization. Some stress is normal and inevitable, of course, but burnout can be prevented. So plan your day accordingly, learn how to prioritize your duties and what needs to be taken care of. Do this at home as well. And that ends today's lecture.